today will provide protections for unborn children
Never
from
been
abortion.
closer to losing a fundamental constitutional right.
In early May, a draft of the Supreme Court opinion on the future of abortion rights was obtained by Politico, indicating that Roe v. Wade is likely to be overturned by the court. However, court opinions are fluid. The official decision will come down this summer, when the court rules on a Mississippi law that bans abortions at 15 weeks. It's a case that forces the court to reevaluate if abortion should be federally protected or if states have the right to limit abortion.
The Mississippi law has challenged the fundamental tenets of Roe v. Wade and even Planned Parenthood v. Casey.
Every indication is telling us that the Supreme Court is going to hand down a decision that may completely overturn abortion rights.
If the court upholds Mississippi's law, that opens the door for dozens of states to follow suit in restricting abortion access. Many already have. Soon, accessing safe reproductive care in the United States could become very complicated for at least 36 million women.
And then the question is, how far is it going to go in changing constitutional law to make that happen?
So how could this decision ripple out and be felt across the country? And what is the future of abortion rights in America?
The Supreme Court today ruled that abortion is completely a private matter to be decided by mother and doctor.
So let's just step back a second. In 1973, the Supreme Court handed down Roe v. Wade, which affirmed the right to abortion. A key piece of the Supreme Court standard is that no state can ban abortion before viability.
It's worth noting that as an underlying matter in Roe v. Wade was this sense of taking women seriously. Women's lives are interrupted, their education, careers, and the harms, physical, psychological, economic, and otherwise, when a person's not able to determine her own reproductive destiny.
2021 proved to be one of the most restrictive years for abortion in recent time, with over 100 restrictions passed. But experts say this Mississippi case, Dobbs v. Jackson Women's Health, is the first significant challenge to Roe in the last 30 years. The law would ban nearly all abortions after 15 weeks. That's about 8 weeks earlier than the constitutional standard, pushing the conservative-leaning Supreme Court to take on the case.
During the Trump administration, 3 new justices were appointed, all very conservative, and they shifted the balance on the court. Both Gorsuch and Kavanaugh joined the court, and that kickstarted a number of states to try to pass abortion bans in the hopes of getting one of them up to the Supreme Court to overturn abortion rights. And then when we had Amy Coney Barrett join the court, everything went into overdrive.
Justice Barrett identifies as an originalist, a judicial philosophy she shares with at least 3 other conservative justices on the court.
I interpret the Constitution as a law, and I understand it to have the meaning that it had at the time people ratified it. Okay. So that meaning doesn't change.
And that could play a role in the court's upcoming decision.
I think most observers agree that Justice Thomas, who has openly said that Roe v. Wade and Planned Parenthood v. Casey should be overturned, is likely to be joined by Justices Gorsuch and Alito. Justices Kagan, Breyer, and Sotomayor are strongly in favor of Roe and Casey and would not want to cut into those precedents at all. Most of the questions have been about Justice Barrett, Justice Kavanaugh, and the Chief Justice.
But based on the draft opinion, Justices Barrett and Kavanaugh seem likely to support overturning Roe v. Wade. So what could happen this summer? The opinion of the court could still shift, but it seems the most likely outcome in this case is that the court decides to uphold Mississippi's 15-week abortion ban and overturn Roe and Casey in full.
In that case, the issue is entirely up to the states. They're allowed to ban abortion or allow abortion at any given stage.
That does not mean that there will be a nationwide ban in effect immediately. What it means is that states will have the option to support abortion rights, to ban abortion, or take on any kind of restriction that's in between those two.
And conservative state legislators have been preparing for this. In fact, 12 states have trigger laws on the books, laws that aren't enforceable yet, but would completely ban abortions if the Supreme Court overturns Roe. And even states without these trigger laws are very likely to pass new bans. Like in Oklahoma, where the governor recently enacted a near total abortion ban, with no exception for rape or incest.
We want to outlaw abortion in the state of Oklahoma.
We have anticipated that 26 states, so just over half the states, will ban abortion or are very likely to try to ban abortion. These are states that have been for years trying to limit abortion access to the legal extent possible.
And what this means is that additional clinics may in fact be forced to close. That's a possibility. We've seen that already in states like Texas, Louisiana, Mississippi, where there's only one abortion clinic remaining.
Abortion already is very hard to come by when you're thinking about people who are living in the South or the middle of the country. When you're thinking about people in the West Coast or the Northeast, abortion is already more accessible.
And some of those more liberal state leaders have done their own preparation for the upcoming Supreme Court decision.
There are states that have enacted legislation or, in fact, moved reproductive privacy into their state's constitutions. States like California, for example, which is now calling itself a sanctuary state. Illinois, Colorado, New York, there are states that are identifying themselves as protectors of reproductive liberty and autonomy.
This bill also protects patients from other states who would seek abortion services in Washington.
Once you have different states taking different approaches, there may be a new set of challenges involving how much a state can regulate what you do outside of it. Whether they can, for example, forbid the importation of abortion drugs into the state. Whether they can penalize the traveling outside of state to get an abortion and come back in. Most of those legal questions are unresolved, and we might see court battles involving them.
And people traveling from their home states will also have an effect on remaining clinics nationwide.
If we think about Louisiana, a patient in Louisiana's probably next closest clinic will be in Illinois. That would be a 1,300-mile round trip.
Since the Supreme Court allowed Texas's 6-week abortion ban to go into effect, nearby states have seen an influx of out-of-state patients. In fact, waits of up to 3 weeks are common in states surrounding Texas.
What we're seeing is that the influx of patients from Texas to other states has a ripple effect, right? It is disrupting the balance of care that had been put in place.
There are going to be people who are left behind. There are going to be children who are left behind who've suffered from rape and incest, who otherwise would want to be able to terminate a pregnancy. There are going to be people who it may be difficult because it will be expensive to travel out of state, either by bus, by train, or by plane.
And even as the landscape has become more and more restrictive, the majority of Americans believe abortion access is important. According to a Pew survey, 59% of Americans say abortion should be legal in all or most cases, and 39% say it should be illegal.
What we have seen is a political will that is inconsistent with the public's will.
Obviously, there will be some serious opposition to the decision if it overturns Roe and Casey, but there would also likely be very serious opposition from a different segment of the country if it did otherwise, because the conservative legal movement, which has something like 40 years of efforts behind it, has seen the overturning of Roe and Casey as a primary goal.
Abortion rates have gone way down since Roe was passed, but nearly 1 in 4 women will have an abortion before the age of 45.
When we're looking at abortion patients are primarily Black and brown people. Patients are also LGBTQ and young. We know that 75% of them are low income.
This is partly because economic inequality has grown in the US, but also because contraception is still harder to access in poor communities, leading to poorer women experiencing more unintended pregnancies.
An abortion costs about $550. That's a lot of money to pull together very quickly. People have to take time off of work, probably unpaid. 60% of abortion patients have children, so they have to arrange for childcare. All of the logistics around abortion just make it much, much harder for some groups to access abortion care than wealthier, whiter people.
This all boils down to an inevitable truth. Many women who would otherwise have gotten abortions will now be forced to carry pregnancies to term. And the US has one of the highest maternal mortality rates among similarly developed countries.
A person is 14 times more likely to die by carrying a pregnancy to term than by terminating it. And we know that the rates of death are even more glaring if you happen to be a Black woman. That's the reality behind reproductive health care in the United States.
The Supreme Court's final decision in the Dobbs case will come down this summer.
It's very hard to predict exactly what the political impact would be, especially on an issue where all eyes will be on the court and where the political polarization will be very intense.
This is a very big decision, but it's not the end of the story. So people will continue to fight for human rights, for bodily autonomy. They will not give up. It's just a very hard fight.